গুড ইভিনিং টু অল, ওয়েলকাম টু নার্সট্রিক্স। আমি তোমাদের সাথে JEPBN 2021 প্রিভিয়াস ইয়ারের 50টা কোশ্চেন আলোচনা করেছিলাম। আজকে নেক্সট 50টা কোশ্চেন আলোচনা করব। তো নেক্সট কোশ্চেন দেখো, দ্য ফার্স্ট ডোজ অফ MR ভ্যাকসিন টু বি অ্যাডমিনিস্টার্ড অ্যাট দ্য এজ অফ অপশান এ 16 to 24 months, অপশান বি 9 to 12 months, অপশান সি 12 to 16 months, অপশান ডি 24 to 32 months। এটার রাইট অ্যান্সার হবে অপশান বি 9 to 12 months। আর এখানে অপশান এ যেটা দেওয়া আছে 16 to 12 months, এটা হলো সেকেন্ড ডোজ অফ MR। দেন নেক্সট কোশ্চেন, at present the sex ratio in India, option A 943, option B 87, option C 933, option D 1084। এটা রাইট অ্যান্সার হবে অপশন সি 933। দেন নেক্সট কোশ্চেন, persistent and recurrent thought, idea or impulse that can be eliminated from consciousness by logic or reasoning is known as, option A overactivity, option B obsession, option C phobia, option D orientation। এটা রাইট অ্যান্সার হবে অপশন বি obsession। দেন নেক্সট কোশ্চেন, a patient is scheduled for electroconvulsive therapy at 9 a.m. and is discovered eating breakfast at 8 a.m. On the basis of this observation, the most appropriate nursing action is, option A the nurse gives notice to the patient physician of the situation and cancel the ECT, option B the nurse remove the breakfast tray and assist the patient to the ECT procedure room, option C the nurse allow the patient to finish breakfast and reschedule ECT for 10 a.m. and option D the nurse increases the patient fluid intake to facilitate the digestive process। এটার অ্যান্সার হবে অপশন এ the nurse gives notice to the patient physician of the situation and cancel the ECT। then next question, most common cause of IMR in India, option A ARI, option B congenital heart disease, option C LBW, option D diarrhea। এটা রাইট অ্যান্সার হবে অপশন সি LBW। then next question, the hallmark of acute ventilator failure is, option A an elevated PaCO2, option B an elevated PaO2, option C an elevated SaO2 and option D an elevated of SpO2। এটা রাইট অ্যান্সার হবে অপশন এ an elevated of PaCO2। then next question, immunoglobulin abundantly present in human milk is, option A immunoglobulin G, option B immunoglobulin M, option C immunoglobulin A and option D immunoglobulin E। এটা রাইট অ্যান্সার হবে অপশন সি immunoglobulin A। then next question, clay colored stool indicates, option A upper GI bleeding, option B impending constipation, option C an effect of medication, option D bile obstruction। এটা রাইট অ্যান্সার হবে অপশন ডি bile obstruction। then next question, disability limitation is mode of intervention for, option A primordial prevention, option B primary prevention, option C secondary prevention, option D tertiary prevention। the right answer হবে option D tertiary prevention। then next question, the total score in APGAR rating system is, option A 5, option B 8, option C 10 and option D 14। এটা রাইট অ্যান্সার হবে অপশন সি 10। আমরা সবাই জানি অ্যাপগার স্কোর টোটাল 10 নাম্বার থাকে, 7 থেকে 10 হলে নো ডিপ্রেশন, 4 থেকে 6 হলো মাইল্ড ডিপ্রেশন অ্যান্ড 0 থেকে 3 হলো সিভিয়ার ডিপ্রেশন। দেন নেক্সট কোশ্চেন, দ্য following are the risk factor for complication associated with NSAID use except, option A age older than 60 years, option B obesity, option C concomitant use of corticosteroid, option D tobacco use। এটা রাইট অ্যান্সার হবে অপশন বি obesity। then next question, a patient is experiencing anxiety attack, the most appropriate nursing intervention should include, option A turning on the television, option B leaving the client alone, option C staying with the client and speak in short sentence, option D ask the client to play with other clients। এটার অ্যান্সার হবে অপশন সি staying with the client and speak in short sentence। then next question 63, all of the following measures are to be taken in the event of a cholera outbreak in a rural community except, option A notification to the district authorities, option B management of case by oral rehydration and tetracycline, option C vaccination of the risk population of the community and option D chlorination of the well। এর রাইট অ্যান্সার হবে অপশন সি ভ্যাকসিনেশন অফ দ্য রিস্ক পপুলেটি অফ দ্য কমিউনিটি, যেহেতু এখানে এক্সেপ্ট বলা হয়েছে। দেন নেক্সট কোশ্চেন, psychopathological repeating of word of one person by another is known as option A emotion, option B elation, option C echolalia, option D enuresis. A right answer হবে option C echolalia. The next question, in case of acute GI bleeding, fluid replacement should begin immediately with option A 250 to 1000 ml of crystalloid fluid, option B 500 to 1500 ml of colloid fluid, option C 500 to 1000 ml of fresh frozen plasma, and option D none of these. এটার right answer হবে option A 250 to 1000 ml of crystalloid fluid. Then next question, the valve of heart open and close in response to option A pressure gradient, option B low oxygen saturation, option C high carbonate dioxide saturation, option D cardiac muscle contraction. এটার অ্যান্সার হবে option A pressure gradient. The next question, conscious recognition of one's own maladaptive behavior is known as option A insomnia, option B insight, option C incoherence, option D intelligence. এটা right answer হবে option B insight. The next question, mental health law of government of India has started from the year option A 1858, option B 1912, option C 1987, and option D 2017. এটা right answer হবে 2017. The next question, the most common postpartum psychosis is option A mania, option B dementia, option C depression, option D schizophrenia. A right answer হবে option C depression. The next question, pathological compulsion to steal is known as option A kleptomania, option B hypomania, option C impaired judgment, option D intoxication. এটা right answer হবে option A kleptomania. The next question, which of the following blood test should be performed before a blood transfusion? Option A prothrombin and coagulation time, option B blood typing and cross matching, option C bleeding and clotting time, option D complete blood count and electrolyte level. এর অ্যান্সার হবে option B blood typing and cross matching. Then next question, most common cause of maternal mortality in India? Option A infection, option B hemorrhage, option C hypertension, option D thrombosis. এটা right answer হবে option B hemorrhage. Then next question, which of the following is most specific of psychosis? Option A pressure of speech, option B neologism, option C incoherence, option D perseveration. এটার অ্যান্সার হবে option B neologism. Then next question, who collaborates directly with the client to establish and implement a plan of care? Option A primary nurse, option B nurse clinician, option C clinical specialist, option D nurse coordinator. এটার অ্যান্সার হবে option A primary nurse. Then next question, which among the following is not a complication of twin pregnancy? Option A low birth weight, option B post maturity, option C abortion, option D chromosomal abnormality. এটা right answer হবে option B post maturity. Then next question, neural tube defect can be prevented by administering option A prenatal folic acid, option B antenatal phenobarbital, option C হলো postnatal folic acid therapy, and option D none of the above. এটা right answer হবে option A prenatal folic acid. Then next question, the prognosis of patient with shock depends on the following factor except option A the type of shock, option B the cause of shock, option C the length of the shock state, and option D pre-existing patient factor. এটা right answer হবে the cause of shock, option B. The next question, following are the nursing intervention for the patient at risk for injury from low red blood cell count except option A avoid prolonged tourniquet use, option B elevate the patient head on pillow for shortness of breath, option C allow for rest between period of activity, option D provide extra blanket if the patient feels too cool. এটা right answer হবে option A avoid prolonged tourniquet test. Then next question, which of the following developmental milestone is expected from a 2-year-old child? Option A uses a spoon to eat, option B use a cup to drink, option C use a knife for cutting food, and option D pour milk into a cup. এটা right answer হবে option B use a cup to drink. Then next question, highest diameter of fetal skull. Option A mentovertical, option B submentovertical, option C suboccipitobregmatic, option D submentobregmatic. এটা right answer হবে option A mentovertical. The next question, the most common side effect of IUCD use is option A ectopic pregnancy, option B uterine rupture, option C excessive menstrual flow, and option D expulsion of IUCD. এটা right answer হবে option C excessive menstrual flow. The next question, as defined by Freud, the ego is that part of the mind that contains option A, the basic instinct and urges, option B, the conscience, option C, the ability to respond to the realities of everyday life, and option D, all element of the holistic person. A right answer hobe option C, the ability to respond to the realities of everyday life. The next question, tetralogy of Fallot is characterized by option A pulmonary stenosis, VSD, ventricular septal defect, overriding of aorta, right ventricular hypertrophy. Option B ASD, VSD, overriding of aorta, right ventricular hypertrophy. Option C pulmonary stenosis, VSD, overriding of aorta, left ventricular hypertrophy. And option D pulmonary stenosis, VSD, ASD, overriding of aorta. এটা right answer হবে option A pulmonary stenosis, ventricular septal defect, overriding of aorta, and right ventricular hypertrophy. Then next question, which of the following statement about chest X-ray is false? Option A, before the procedure, the patient should remove all jewelry, metallic object and buttons above the waist. Option B, a signed consent is not required. Option C, eating, drinking and medications are allowed before this test. And option D, no contraindication exists for this test. It is right answer hobe option D, no contraindication exists for this test. The next question, psychosocial therapy is propounded by option A Sigmund Freud, option B Erik Erikson, option C Jean Piaget, and option D none of these. এটা right answer হবে option B Erik Erikson. Sigmund Freud এর হলো psychosexual therapy. Then next question, midday meal program was started in India. Option A 1961, option B 1981, option C 1991, option D 2001. এটা right answer হবে option A 1961. The next question, the umbilical cord contains following blood vessel. Option A 2 arteries on vein, option B 2 artery on vein, option C 2 vein and on artery, option D 2 veins only. এটা right answer হবে option A 2 arteries and on vein. আমরা জানি আভা 2 artery and on vein umbilical cord. Then next question, living standard of people is best assessed by option A IMR, option B MMR, option C physical quality of life index, option D death rate. এটা right answer হবে option C physical quality of life index. Then next question, the major contribution in amniotic fluid is by option A fetal urine, option B fetal plasma, option C mother plasma, and option D mother's urine. এটা right answer হবে option A fetal urine. Then next question, biomedical concept of health is based on option A germ theory of disease, option B absence of pain, option C social and psychological factors, option D equilibrium between man and environment. এটা right answer হবে option A germ theory of disease. Then next question, the type of play a toddler is engaged in. Option A solitary play, option B cooperative play, option C parallel play, option D group play. এটা right answer হবে option C parallel play. Then next question, a high pitched cry is seen in option A hunger, option B anger, option C mental deprivation, and option D intracranial tension. এটা right answer হবে option D intracranial tension. Then next question, which of the following is a sign or symptom of a hemolytic reaction to blood transfusion? Option A hemoglobinuria, option B chest pain, option C urticaria, option D distended neck vein. এটা right answer হবে option C urticaria অর্থাৎ গায়ে র্যাশ বেরোবে. Then next question, the two blood vessels most commonly used for TPN infusion are Option A, subclavian and jugular vein. Option B, brachial and subclavian vein. Option C, femoral and subclavian vein. And option D, brachial and femoral vein. এটা right answer হবে option A, subclavian and jugular vein. Then next question. A patient who refuses to take bath stating that water and soap are poisoned is a typical example of option A, suicidal ideation, option B, delusion, option C, negativism, and option D, hallucination. এটার অ্যান্সার হবে option B, delusion. Then next question, 50% glucose and regular insulin is used for the management of hyperkalemia because it option A, stabilize the irritability of a cardiac muscle, option B, improve metabolic acidosis, option C, transport K plus from extracellular to intracellular compartment and binds the K plus ion for excretion of in the feces. এটা right answer হবে option C, transport K plus from extracellular or intracellular compartment. Then next question, lifespan of fetal RBC. Option A, 50 days, option B, 80 days, option C, 100 days, option D, 120 days. The right answer হবে option B, 80 days. Then next question, early breast cancer detection in asymptomatic individuals above 40 years of age include option A, clinical breast examination by health professional every 3 years interval, option B, annual mammogram, option C, annual pap test, and option D, endometrial biopsy. এটা right answer হবে option B, annual mammogram. Then next question, by which the effectiveness of nurse client communication is best validated. Option A, client feedback, option B, medical assessment, option C, health team conference, and option D, client's physiologic adaptation. এটা right answer হবে option A, client feedback. Then next question, unconscious defense mechanism in which the person undergoes a partial or total return to earlier pattern of adaptation is known as option A, regression, option B, repression, option C, reaction formation, and option deception. এটা রাইট অ্যান্সার হবে অপশন এ, রিগ্রেশন। তো আজকে টোটাল 100টা কোশ্চেন আলোচনা করা হয়ে গেল 2021 সালের। অসংখ্য ধন্যবাদ সকলকে এতক্ষণ সাথে থাকার জন্য। সকলে ভালো থেকো, সুস্থ থেকো।